All right, for this next part of the lecture, I wanted to briefly talk to you about non-governmental forms of insurance or non-governmentally funded insurance plans. The two most popular, which make up about 50% of how individuals are covered, are HMOs and PPOs, health maintenance organizations and preferred provider plans. COBRA, if you can remember in the definitions we described earlier for health insurance, is used to describe the plan where you can extend your health insurance even if you lose your job for 18 months after you are no longer employed. So you're still carrying out one of your either HMO plans or PPO plans for up to 18 months after you're no longer working for that job. And you're still paying the same amount of premium, the same premium for that plan. So we're really going to focus more time right now on HMOs versus PPOs. By the way, when you go to start a new career or job, if it's a larger organization that has to offer health insurance, you'll be able to choose between an HMO and a PPO. So let's look at some of the difference of what these are. Within an HMO, you're basically having access to certain doctors and hospitals within a network. The network is made up of providers that have agreed to lower their rates for plan members and also who meet certain quality standards. This plan doesn't necessarily cover if you see a provider that's outside of your HMO's network. So let's say that you really respect this one healthcare provider, or previously with other healthcare insurance plans, you saw this person as your primary care provider. But now with your new HMO plan, that person's no longer covered as an in-network provider. It just makes it that much harder to see that person, or that much more expensive to see that provider who's outside of the network. Also, there are typically more restrictions for coverage as compared to PPOs, such as allowing only a certain number of visits, tests, or treatments. So that's some of the negative sides of the HMO, but some of the more positive sides of an HMO is you tend to have lower premiums, so less that you pay per month or per year for your health insurance for access to health insurance. And sometimes you have lower or no deductible that needs to be met before your health insurance can kick in. So it's not like you have to spend X number of dollars and then your health insurance kicks in. So these are two real selling points for working within a health network, not working, but having a health insurance plan within a network, because overall it's less expensive. However, if you do have more specialized providers, if you want to see someone without your primary care provider having to give you authorization, if you don't want to necessarily have to seek referral to even see a specialist, you might want to go for a PPO plan, a preferred provider plan. So with these plans, you can see the doctor or specialist you'd like without having to see your primary care provider first. You can see a doctor or go to a hospital outside of any network, and you can be covered. However, your benefits will be better if you stay within the PPO network. So there's a network there as well, but again, you can still go outside of that network to get care. In this plan, premiums do tend to be higher, and it's common for there to be a deductible for accessing healthcare visits, resources, pharmaceutical drugs, etc. There are also private insurance plans. These are not backed by employees, not subsidized by larger organizations who are helping to cover healthcare costs. They're also not governmental source or governmental funded sources of health insurance like the Medicare, Medicaid, and S-CHIP. They're often expensive, and previously there have been the threat of medical underwriting and rescission, where private health insurance companies could go back, review your health history, and decide whether or not they want to cover certain services, even if you've been paying premiums, because they might find something in your health history that made you more of a threat to cover financially. And so that's when, if you remember in the video, Sick Around America, there was that threat of medical underwriting and rescission, that taking back of healthcare coverage.